Hello, good morning, sir. My name is Hector Angeles. I'm a nurse. I'm here because I'm going to be working with you. I need to do a head-to-toe assessment if that's okay with you. What we're going to be doing, pretty much I'm going to check your whole body. We're going to check that everything is fine, that everything is normal. We're going to take some notes, if you don't mind. The assessment does get a little bit too private, so if anytime you feel uncomfortable, and we can bring in a nurse so we can be with us. If you feel any pain, if you feel anything, you can ask me any questions. We can stop, we can take a little break, and we can continue. Is that okay with you? Let me close the door. I'm gonna wash my hands. I'm gonna put some gloves. Can you please state your name and date of birth? Okay, Mr. Hulk. Let me check your wristband really quick. Okay, that's correct. Do you know who's the president of the United States? Trump, okay. Do you know what day of the week is? It's Monday, okay, that's good. Do you feel any pain right now? No pain? Let me ask you, when was the last time that you went to the restroom, that you have that you pooped? Yesterday? Did it hurt? Any bleeding? No? Sounds good. When was the last time that you peed? Today in the morning? Okay, not bad. Did it hurt? Any issues with that? No? Okay, sounds good. Okay, so like I said, the assessment is just to make sure that everything is fine. We're gonna take some notes and everything, just to make sure. Let me tell you, all this information is confidential, so pretty much nobody can look at it, not your family, not your friends, anybody, except for the people that is gonna be working with you. So if that makes you feel a little bit more comfortable, all the information is gonna be private, okay? Sounds good? Okay, sir, I'm gonna check, first of all, I'm gonna check your vitals. So I'm going to check your temperature. Okay. Then I'm going to check your oxygen and your pulse. And when I leave that, I'm going to check your blood pressure as well, just to make sure, just to have a range of what's the usual for you. Okay. Okay, blood pressure good, temperature good, pulse and oxygen good as well. Okay. So how are you feeling today? Good. Okay. I'm going to check your head. Okay. I'm going to be touching you a little bit. Okay, I'm gonna check the head and the hair. The hair, I'm gonna check for symmetry, that there's no baldness, that there's not an infestation. I'm gonna check all the way just to make sure. Color, symmetry, everything seems fine. Okay, sir, I'm gonna be checking your face, your eyes, your ears, your mouth. And I'm gonna start with your eyes, okay? For your eyes, I'm gonna check for perla. I'm gonna check that your pupils are equal, they're reactive to light and accommodation, okay? So let me do this real quick. Okay. Sounds good. We're gonna check the sacral gland as well. Alright. Can you blink for me? Good. Can you move your eyebrows for me? Good. Okay. I want you to follow this light, to look at this, and then to look to the watch on the wall, okay? Look at this and then to the wall. Okay, good. Ears look good. I'm gonna be checking your mouth, okay? I'm gonna use this tongue depressor to check your mouth, okay? Can you open big for me? Okay, I'm gonna check your teeth. Your teeth seems fine. Your tongue, not any redness, nothing bad. Can you pull your tongue up for me? Okay. Good. I'm gonna touch to see if you can gag, okay? It's gonna be a little bit uncomfortable, just hold up with me, okay? Okay, good. Seems fine to me. Okay, good. I'm gonna ask you to taste this. Tell me if it's sweet, sour, spicy, okay? It's sweet. The other side, sweet as well. Okay, good. Then I'm gonna be checking your nose, okay? I'm gonna be palpating for your maxillary and frontal sinuses just to make sure that it doesn't hurt. Okay, good. No pain in your nose? No? Good. Okay, can you pull down for me? Okay, I'm gonna check the inside of your nose. I'm gonna cover it one nostril at a time. Every time I cover, can you exhale for me? Okay. Okay, good. As well, I'm gonna check your septum. There's no discharge, no objects in there. Straight. Okay, good. I'm gonna be checking your ears now, okay? I'm gonna use Gonna check the outside first. Okay, symmetric, no pain, no tenderness, nothing. The inside seems fine to me, no discharge, no. Okay, good as well. This thing is called otoscope. This thing is I'm gonna be using to check the inside of your ears. Pretty much, I'm just gonna check that there's no earwax accumulated in there. I'm gonna check your tympanic membrane. Okay. Okay. Should look great. Kind of pearlish. Looks good. Some earwax is normal. Okay, good. Also, I'm gonna check that you can smell really well or really bad. Okay. So I'm gonna ask you to smell this one nostril at a time. That smells like flowers. Okay, good. Also, I'm gonna check your hearing. What I'm gonna be doing is I'm gonna whisper a word on each side of your ear, and I want you to repeat it for me, okay? Flower, okay. Car, very well. Then I'm gonna do what is called Rhino Weaver test. That's gonna help me to check your ears as well, okay? This fork, what I'm gonna be doing, I'm gonna put it in your head, and it's gonna sound like a vibration, okay? So I want you to tell me if you can kind of hear it, feel it in the same way in both ears, okay? You feel the same? Okay, good. Also with this, I'm gonna put it behind your ear, and I'm gonna check as well, okay? Same thing. Tell me when the sound stops. Okay, sounds good. Now I'm gonna be checking your neck, okay? So at this point, I want you to sit down at 45 degrees. I'm gonna check your veins. What I'm gonna asking you is to turn around, turn your neck to the left and to the right, okay? Okay, no GBD. Okay, good, sounds good. Same on your neck, I'm gonna palpate just to make sure that you don't have any masses, any pain, any tenderness, that your neck is not stiff or anything like that, okay? That's why I'm doing this. I'm gonna check your veins one at a time. Okay, good, good. Gonna check your trach as well. Midline, no masses, no pain. Okay, good. Gonna be checking your thyroid now. For your thyroid, it's better if I check it from the back, but it's kind of like hard right now, so I'm just gonna do it through here, okay? I'm gonna put my hands there. Can you swallow for me? Okay, good. No masses. That's good. No pain? No pain at all? Okay, good. Now I'm gonna put my hands on each side of your head. So what I want you to do is kind of push my hand, okay? Okay, good, strong. Now can you move your neck to the sides and to the back? Okay, good. Now I'm gonna be checking the rest of your body, okay? I'm gonna check for skin trigger, so you're gonna feel a little pinch in your neck, okay, and your shoulders. Good. Good as well. Then I'm gonna be checking your arms. For your arms, the skin looks good. While I'm doing this, I'm gonna be checking your whole skin just to make sure you don't have any lesions, any rashes, any tenderness, any bumps or anything like that, okay? Okay. In your hands, I'm gonna check for pretty much I'm gonna check that you have a good circulation, okay? So I'm gonna be pinching every of your fingers. One at a time. It should be less than 3 seconds. Okay, good. I'm gonna be checking your nails as well. Nails look good, clean. Do you clear your nails? Okay, good. A little bit thick. Okay, I'm gonna check between your fingers. Okay, good. I'm gonna check your pulses as well. I'm gonna check your fingers in this hand as well. One at a time. Good. And then I'm just gonna check your pulses, okay? What I'm doing right now, I'm just checking that pretty much your circulation goes well and it kind of feels the same. It has the same rhythm, and it feels the same in both arms, just to make sure that it's kind of the same. Okay, everything looks good until now. Your arms look good. Okay, I'm gonna be asking you to do some movements with your arms. Can you squeeze my hands? Okay, can you push up, down? Now can you move your elbows? Okay, you have good range of motion, no pain at all. Okay, good. Very good. I'm gonna ask you if you can swallow a little bit of water. You don't have any trouble with your mouth at all? No? Okay. Okay, good. Very good. Now I'm gonna be checking your chest, your abdomen, and your back. Okay. With this, I'm gonna be checking that. I'm gonna check your heart sounds and your lungs. Okay. I'm gonna check your heart sounds first. So I'm gonna check the pulmonic, which is on the right side, midline clavicle. Atrial, and then pulmonic on the left side, pretty much on the same side, the other side. And then I'm going to check the Erb's point, which is the third intercostal space next to sternum. And then tricuspid, which is fourth intercostal space, kind of between the sternum and midline. And then I'm going to check the mitral. For the mitral, I'm going to ask you to kind of turn to the left. That's called left recumbent position, just to make sure that sounds better. Okay, so I'm going to ask you to kind of turn, and that I'm going to do it for a whole minute. Okay, your hair looks pretty good, sounds really good. Since I have my stethoscope as well, I'm going to be checking your lungs as well. What I'm going to be doing is kind of like a zigzag motion, so I'm going to start right below the clavicle, and I'm gonna do kind of in a zigzag. Okay, so I'm gonna start. It's gonna be 8 points. Every time I put my stethoscope, can you take a deep breath? Okay, really well. Your lungs sound really clear, no friction, bro, no wheezing, no nothing abnormal. They sound really good, so they sound really clear. Okay. Your chest, can you take deep breaths? With this, I'm gonna ask you to lay down and just put a pillow underneath. Okay. So your chest, it has good symmetry, no nothing abnormal, no symmetry, really well. Then I'm gonna check your abdomen. With your abdomen, first I'm gonna cover you again. You don't have any pain right now? No, I don't see any masses. Good. Next, I'm gonna auscultate. Okay. Gonna start on the right lower side. Okay. Are you hungry? Yeah, I hear your sounds. They sound hyperactive, which they're really fast, pretty much 5 to 10 seconds. That's really good. That's normal to hear those sounds. If at any point I start checking and I don't hear anything by 5 minutes, I will ask another nurse to come help me check out, just to make sure. But since everything seems fine, good. Now can you sit down for me, please? Okay. While you're sitting down, I'm gonna check your back. I'm gonna palpate. No pain, no masses. Okay, good. Gonna check your spine, straight, no signs of scoliosis or kyphosis. Okay, good. Now I'm gonna hear your lung sounds from the back. Same thing that I did right now. I'm gonna put my stethoscope every time you feel that I move it. Can you please take a deep breath? And same is gonna be a zigzag motion. It's gonna start like pretty much the same thing that I did on the front, but in the back. And I'm gonna go more to the sides on the back. Okay. So I'm gonna start on the right side, right below clavicle, and I'm gonna do a zigzag. Okay. Take a deep breath. Take a deep breath. Okay. Really well. Again, your sounds from the back sound really good, pretty clear. I don't hear anything bad, no wheezing, no friction rub. So it's pretty good, pretty normal. Okay. Next thing I'm gonna check your breasts. I know that's a little bit uncomfortable for you. If you want, I can bring another male nurse or a female nurse. Is that okay with you? Okay, good. So we're checking your breasts. For a male, I'm going to check same thing for a woman. For a tenderness, any masses. If you're good, I'm gonna check the areola. No pain, no nothing, no discharge, no redness, no nothing. Okay, good. I'm gonna cover your back. Now I'm gonna jump to your legs. First thing that I'm gonna do, I'm gonna check your femoral pulses, okay? It's gonna be right here. Okay, good. And I'm gonna be checking your legs. While I check your legs, I'm gonna check your hair distribution. I'm gonna check that you don't have any varicose veins, any pain, any lesions. I'm gonna check for movement as well, okay? I'm gonna check the popliteal pulse. That's below the knee, in the back of the knee, I'm sorry. Okay, good. Same, I'm gonna check in both at the same time just to make sure they're kind of the same, that they have the same rate, the same rhythm, your circulation pretty much, okay? Now I'm gonna press a little bit on your leg. That's just checking for edema. Okay. No edema. Legs look good. Now I'm gonna be checking your pulses as well. Again, at the same time, just to make sure that they can understand that you don't have any issues right there, okay? It's gonna be the femoral. No, sorry, the femoral was over there. This is the lateralis spiralis. Then I'm gonna check your legs as well. Your legs, I'm gonna check that you have movement in your fingers, that you don't have any pain, that you can actually move your toes, no fingers, toes, I'm sorry. I'm gonna check your nails. I'm gonna press every nail the same, one at a time, just to check for pulse, for circulation. I'm gonna check between your toes, especially for older people. We tend to check these really well, just because older people tend to have trouble taking care of themselves, so they kind of go with injuries and not knowing, especially with diabetic people. Okay, same here. I'm gonna check your nails as well. And I'm gonna check your pulse as well. There's all these petties. They look good. Okay, I'm gonna do what is called Babinski. Pretty much I'm gonna just move a little bit of with a sharp cutter, just to make sure what's your reaction, okay? So I'm gonna do really well. You move your fingers, that's pretty normal. Okay, good. At this point, I'm gonna change my my gloves, and I'm gonna put new ones. Just because I touch your feet, and just to be more clean, okay? On your legs, can you please push down for me? I'm gonna check your range of motion and your strength. Down, up, then below your knees. Can you pull? Good. Down. And can you do like a movement with your feet? Okay, range of motion sounds good. Looks good. Everything's pretty good. Do you have any questions at this point? Okay, good. I'm gonna go back to your feet, and I'm gonna ask you to push that towards me. Okay, and towards you. Really well. I'm gonna have to change my gloves again. No problem, we have a bunch of gloves. Do you have any questions right now? No? Okay, good. Do you have any pain? No. Good. Okay, do you think you can sit down for me? You don't have any trouble? You don't feel dizzy or anything like that? No? Okay, good. So you're gonna sit down for me. If at any time you feel dizzy, let me know, okay? I don't want you to get injured or to fall from me, okay? Checking for orthostatic hypertension. I'm gonna check that you don't get dizzy or anything like that. A couple of seconds, okay? Good. While you're sitting down, I'm gonna ask you to do something for me with your eyes, okay? I want you to follow the light. So pretty much I'm gonna check your cranial nerves just to make sure that everything looks good, okay? I want you to follow with your right eye the light, okay? Okay, same with this one, now with the left. Okay, do you think you can stand up for me? Okay, while you're standing up, I'm gonna check your cerebral performance, okay? So what I want you to do, I'm gonna perform the Rumber test, okay? So I'm gonna stay behind you, and I'm gonna kind of hold you, and I want you to close your eyes. I can be on the back or I can be on the front, just to make sure that you don't kind of move, okay? Okay, close your eyes, okay? Good, no movement, okay, looks good, okay? While you're doing, you do a couple steps for me, okay? With there, I'm gonna check that you have a good balance, that you don't kind of like move, you don't feel dizzy or anything, okay? And then when you're coming back, I want you to walk kind of funny for me. I want you to do a heel to toe walking, okay? Kind of like when you get a DUI, just to make sure that you're walking good, okay? So you're doing it pretty well, pretty well balanced. At this point, I think you can lay down or sit down again for me. What I'm gonna be checking right now, I'm gonna check your private parts, okay? At this point, if you want me to bring another nurse, just to be more comfortable, just to be safe, it's up to you. You feel good with me? Okay. For a male, we'll check the penis, we'll check the hair distribution, we'll check the penis, we'll check the, that there's no redness, no discharge, no tenderness, not any pain, any masses. Okay. As well, I'm gonna check the testes. No lesions, I'm gonna check one at a time. Any pain, no masses, no tenderness, okay, good. For the woman, I will check pretty much the same, just different parts. I'll check the labia, the clitoris, and the vaginal opening, okay? I'll check for any redness, discharge, any lesions, anything that doesn't look good. Okay, I'm gonna change my gloves again. At this point, I'm gonna check your anus. I'm just gonna make sure that everything looks good, okay? Is that okay with you? Okay, good. Can you please turn to the right for me? Okay. I'm gonna check the anal cavity. I'm gonna check that you don't have any redness, any discharge, any hemorrhoids. Everything looks good. No discoloration or anything. Hair distribution looks normal. Let's go. I'm gonna check your butt cheeks. No pain. No redness, no masses, everything looks good. Let me get you comfortable. I'm gonna change my gloves again. At this point, I think for now I'm done. Like I said, the purpose of this examination was to just make sure that everything seems fine. Thankfully, everything looks good on you. Do you have any questions? No questions. Okay, sir. If anything, if I need any information, is that okay if I come back with you? Okay, good. Like I say, my name is Arturo Angeles. I'm gonna be here helping the nurses. If you need anything, there's your call light. You can call me anytime, okay? Thank you very much. I'll wash my hands again, and then I open the door, and that's it.